Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. We are still doing our sessions in patient safety. This is topic 7, introduction to method of quality improvement. Learning objectives explain science of quality improvement and its impact on healthcare, differentiate between the measurement for research and measurement for learning and process improvement, describe the basic principles of quality improvement, describe quality improvement model and change concept. Quality improvement in health refer to systematic effort to enhance patient outcome by improving healthcare delivery and increase the efficiency of healthcare system. This involves identifying area of needs and gap in healthcare delivery, implementing significant and important change or changes, and continuously assessing the effectiveness of these changes to ensure better performance and patient care. Quality improvement has significant impact on healthcare. It improves patient outcome, safety, and patient satisfaction. It enables better patient engagement. It improves communication throughout the organization from bottom to top and from top to the bottom, and it also increases staff satisfaction, staff engagement, and staff retention. This will increase the organization efficiency and its impact on the society. And it also important for the organization because it enables the organization the compliance with regulation. In addition, when you spend in quality, you will save a lot of costing, and definitely it is related to sustainability of healthcare delivery. There is a difference. There are some differences between the measurement from research and measurement for learning and process improvement. So the purpose in research, we would like to discover new knowledge, while in quality and process of improvement, to bring new knowledge into daily practice. So we want to put this knowledge into action. In research, we do large blind or randomized control trial, but here in quality improvement, many sequential observable tests, so that it can represent the real life. In research, control for as many biases as possible, while in quality improvement, stabilize the bias from test to test. In research data, gather as much data as possible, while in quality improvement, gather data just enough to give us a learning and real picture of what is going on. In research, duration can take long period of time to obtain the result, while in quality improvement, small test of significant changes accelerate the rate of improvement. Science of improvement is important for all healthcare provider, but the depth varies. Like for student and frontline provider, the just general understanding is enough, while quality officer or change agent, they need to have more depth. Usually this can be represented by driving a car. You can drive it without knowing how does it generate its energy. So general knowledge about quality improvement and methodology is important to all healthcare provider, but depth of that knowledge uh, is done by those who are responsible for quality and system improvement. The science of improvement, it requires that appreciation of a system, understanding of system variation, theory of knowledge and to know about psychology. To appreciate the system, patient care outcome involve complex system of interaction between patient, healthcare professional, procedure, equipment, environment, and organization. Therefore, it's important to understand the interdependencies and relationship among all these components. Second component, understanding system variation. We should keep in mind that variation is a feature of most systems. Shortage of personnel, equipment, drugs, or beds can lead to variation in care delivery. Variation is a difference between two or more similar things, such as the success of some operation like appendectomy, if it is done in one hospital compared to another, by one surgeon compared to another, or even by a surgeon or a fellow, if it is open or laparoscopic, or even outcome for management of different disease. There is extensive variation in healthcare and patient outcome, and this can vary from hospital to hospital, from region to region, or even from country to country. The third component is about knowledge theory. This knowledge is required so that we can predict if we make a change, it can end with better result. Predicting the result of a change is necessary step in the planning phase. But it's important to recognize that people in the organization, they have better understanding of the organization culture, the behavior of the individual, and the resources, or even the acceptance of the consumer as a patient and their family. So the knowledge theory, it helps us to make a plan and predict the change, but it's very important that we come and assess how powerful was our prediction, and what factor augmented the change, and what factor blocked these changes. The fourth component is about knowing about psychology. The understanding some psychology help us to know how people interact with each other, and how do they interact with the system, how do they accept change, do they endorse it, do they resist it. So knowledge about psychology help us to navigate implementation of change in the organization. Whenever we make change, we need to make certain measures. These types of measures are outcome measures, process measures, balancing measures. For outcome measures, example include the frequency of adverse event, number of unexpected death, and patient satisfaction. These can be done by survey, by interviewing the patient, or by auditing medical records. For process measure refer to measurement of how does the system work. This measure focus on component of system associated with particular outcome. So the process, how does it lead to the outcome? It is done when we want to find out how well a part or aspect of healthcare service or a system is working. Some specific example include like how frequent we measure swab count during surgery. Drug administration, how frequent we delay administration of the drug. And ICU beds, how frequent the ICU is blocked and there is no access to beds. Improvement principles underpinning models for improvement. Quality improvement include any process or tool aimed at reducing quality gap in systematic or organizational function. There are some principles of quality improvement. They are intuitive. We have to involve the patient and their family. It should be patient and family focused. There should be strong leadership engagement, and we have to involve all team. All those who are involved in the process should be involved because they are the person who recognize the gap, and they are the one who can give suggestion to the best solution, and they are the person who gonna implement these solutions. We should use a process approach and use system approach to management. This is a continuous process. We have to assess the outcome and then do it again. A factual approach to decision making and relationships that are mutually beneficial to all parties. One of the method used in quality improvement is PDSA, puts a plan, do, study, act cycle. What are we trying to accomplish? One of the models of improvement we use frequently in health system puts a plan, do, study, act. It's about what are we trying to accomplish, how we will know that a change is an improvement, what change can we make that will result in an improvement. These go in cycles and we can repeat it many times. So plan, plan a change or a test, implement that, carry it out, then study the outcome. See if it lead to improvement or no improvement, then determine, act on that and determine what further you need to do, and you repeat the cycle: plan, do, study, act. Plan, do, plan, do, study, act depend on change concept are general ideas with proven merit and sound scientific or logical foundation that can stimulate specific ideas for change that lead to improvement. To create these ideas, it requires a team. People sit together. It requires critical thinking about the current problem, and then create creative solution by observing the process, and sometimes you can consult the literature and find solution implemented by other. Also you can engage your patient and see their suggestion how you can improve this process. Insight gain for completely different area. If this represent a model that done somewhere else, you can try to utilize the same concept of change. These changes can also depend on guideline, but guideline is an abstract concept. We have to change it into action plan that fit our workplace and environment. For example, if we would like to implement hand hygiene to reduce the rate of infection, then we need to teach and train the people. We need to have the resources so that we make it easy for them to do it every time, and we have to base it on human factors and system factors. To implement plan, do, study, act, and healthcare quality improvement, we need team. We need team for improvement. A team need to be established. Team need to set out aim, so they should have a clear aim and clear objectives. They need to establish how they will measure the changes, and team will need to select the changes that can be implemented in that context. All improvement require change, but not all change can lead to improvement. The change team, through critical thinking, brainstorming, creative thinking, they can come with solutions or changes. They have to implement these in a limited area in the facility, and they have to assess if these changes lead to improvement, as if there is no improvement, then they have to study the outcome and redesign the process again. But if there is an improvement, then they can expand that to other areas till they generalize to whole hospital. There are some categories it can help the team to focus on by eliminating the waste, improve workflow, optimize inventory, change the work environment, redesign the environment, enhance the relationship with the patient who is the consumer, manage time, try to eliminate any waste in time, and also manage variation, try to standardize the process, design system to avoid mistake, focus on the product or service. Take home, we're going to continue this session in another short session, but take home from this part: quality improvement methods and tools improve patient care and reduces error. And improvement project depend on appreciation of a system, understanding variation, knowing theory of knowledge and psychology. In quality improvement, different measures are needed, like process measure, outcome measure, and balancing measure. Plan, do, study, act is a model of quality improvement. Team dynamic, leadership, patient engagement are very important for effective quality improvement project. And thank you.